Hi, doctor. Still thinking a little bit about maybe we could call this part 2 of the how to get about 98+% acceptance of your orthodontic treatment presentations to your patients, because it's really easy to do. I already talked to you in the first part of these videos about the fact that it starts with the fact that they already love you, they already trust you, and they want you to take care of them. So that's a really fantastic place to start. The second thing that I want to talk to you about now is how you present and what you give them in your presentation. You know, all of the software manufacturers are real good about saying, put it on the screen and let them look at the child's pictures or their pictures, and that's great. All of that's great. But let me just tell you something. Let's step back for a minute and talk about during your presentation, like I say, what you're giving them, what you're telling them, what they walk away with. And there's the whole thing that I want to talk to you about today. First of all, when you start with all of the examination data, with all of your angles and measurements and information and categories of growth and categories of muscle behavior and categories of occlusion, as you have all of that ready for your patient, it needs to be written down in a way that they can actually understand at least what you're calling it. They may not know what it means. They may not go home and remember, but they see that you have taken a piece of paper, which I would suggest you use word processing, give them a piece of paper that they are following through during your presentation and that they take home at the end. Now, what does this piece of paper have on it again? Okay, the front page has your findings. The front page has their name or their child's name. It has information about their skeletal situation. How did their bones grow? How did their head grow? And I show them, we're going to talk about the upper jawbone, the maxilla, and the lower jawbone, the mandible, but tell them a little bit about their skeleton. And then have a section right after skeletal on growth, as far as anything having to do with, I like to do height prediction, which I get from Rocky Mountain Diagnostic Services. I think that's a fantastic little thing to put in there. If it's a child, I like to have that, and there's both their actual chronologic age as well as their bone age. Then the next section that I put on that front page is airway, anything to do with breathing, any symptomatology whatsoever, any signs whatsoever, and anything I see on the x-rays as far as enlarged tonsils, dense turbinates, deviated septum, enlarged adenoid tissue, narrow space between the posterior of the inferior turbinate and the adenoids, anything you can find about airway. Then there should be something about anything you've found that's out of the norm as far as muscle and joint and occlusion kinds of disorders, or anything that doesn't seem completely normal. Finally, you're now going to finally talk about teeth, and that section I call dental. And the dental section on their treatment page says what their classification is as far as class 1, class 2, class 3. It says what their overbite is, what their overjet is. It says what's crowded, what's spaced. It talks about frena. It talks about plaque levels and oral hygiene in general. It talks about gingivitis. It talks about Bolton discrepancies. And all of these things get laid out on that front page. Do they need sealants? If it's a child, do they have sealants on all of their molars and maybe on bicuspids, depending on their risk? All right. Now the page on the second side, the back, if you will, is what is our recommendation to address each of these findings. And that's where we lay out our treatment plan. And it says everything that we plan to do. It says braces for how long. It says whether any teeth need to be extracted, primary teeth or permanent teeth. It says whether the treatment is going to take 12 plus or minus 3 months, 15 plus or minus 3 months, or in a complex case, 24 plus or minus 3 months. Whatever time frame you are estimating is there. Extractions are there. The actual sequence of, if you're going to do, let's say, sagittal correctors and then expansion, is there. The actual first few appointments is there. Separators, then band fit and impression, then delivery of lower lingual arch, whatever it might be. All of that is there. And finally, the cost. what your charge is, which you probably have already told them your estimate when you did the examination, but put it down. All of that is there. Then I have a little concern section. If there's anything that I want them to be particularly aware of, that their child or they were a vertical kind of grower and now have a vertical pattern with severe low forward tongue position. A lot of kids have that today. A lot of kids. And finally, concerns might be that they're a class 3 grower, that they have possible excessive mandibular growth that we can't anticipate well. Whatever it is, the concern is there, and I read it to them. And then finally, there's a little section for this has been explained to me, we have reviewed it, and I have gotten my questions answered, and they sign, and you sign, and your staff signs, and the date is there. So everything that they need to know about the treatment to come has been laid out for them. They may still have questions because they don't remember or understand what's there, but they know that you did your best to put it down in language that they could understand. And the language I use is quote lay language, but quite frankly, my physician and health professional parents or patients are also understanding it quite well. They have no problem with the fact that I call something bite, and then in parentheses I say occlusion, or vice versa. So I try to use language that's clear to them. So the second part of 98+% acceptance of what you propose for them is to have a very clear and very well laid out, written down plan of treatment that they take home with them. Besides, I can't tell you how strongly I recommend that you give them an actual copy of their initial photos and of their initial panoramic. Does it mean anything to them? Yes, it's them. Of course it means something. They absolutely, what do we love? If you look at a picture of a group, you go on vacation, here we are in Greece, and 2 or 3 people are together on the beach and we take a picture. What is the first thing you're going to look at in that photograph? You're going to look at you. Think about it. Give the patients their photos or their child's photos. So now you've got the second part down. You start out with them wanting you to treat them and being intentional and present with them to show them how much you care. And now you have the second part, which is write it all down, go over it, take the time, schedule half an hour, be sure they can ask questions, and make them understand how much you care and what you plan to do. You know what? Now you're at your 97, 98%, and I actually have a few more thoughts for you, but those will suffice for today. Have a wonderful day. This is Dr. Chris signing off.